Waiting a few more minutes. I think it is now toward noon. So Steven, would you like to go ahead and start today's meeting?
Absolutely, absolutely. Um, let's see. All right, let's see. This happens. I say we wait just another minute or two, just so that's another few people popping on here. 2 minutes, another minute. All right, we'll go ahead and get started. I think a few people will trickle in. Uh, Welcome everybody to the February 2026 edition of the CR2C2R Wow. CR2C2 seminar series. Super happy to have Karen Lightman, who's the executive director of the Safety 21, the national UTC based at Carnegie Mellon University. Karen comes to us with a background in public policy. She's like me. She's done a lot of transportation technology transfer and trying to figure out good ways to get research results out where people can use them. I also find her one of a very pleasant colleague to interact with when we see each other at conferences and such. So I think this will be really great. It's a great opportunity for us as a regional UTC to interact with and synergies and all those type of words with the national UTC. And it's great that she's going to come and talk to us about something that's that's covers the rural context that we focus largely on. So thanks for being here, Karen. And with that, I will turn it over to you.
Awesome. Well, I love that introduction, and likewise, Stephen. Every time we're getting together, whether it be in a serious context, going before Congress and meeting with staffers, or trying to connect with an Uber who has no location GPS, we have a good time. So, everybody, it's great to see some familiar names and faces out there. Thanks for joining us. I have a slideshow today, so I'm going to get started on that. And hopefully, y'all can see all my slides. And I love Q&A. It's my favorite part. It's the best part of connecting with folks. So please don't be shy, okay? I'm okay if you interrupt me. Raise your hand because I'm gonna minimize my distractions here. But please raise your hand, ask a question, feel free to interrupt, and I want to have some fun here. So, as mentioned, I'm the executive director of Safety 21. We're the US DOT National University Transportation Center for Safety. I also wear a little hat on the smart cities side. I am also executive director of Metro 21. I've been in that role for 8 years at Carnegie Mellon, and I've been in the Safety 21 role for about two and a half. So I kind of say my Metro safe smart cities is everything and the kitchen sink, while Safety 21 is really focused on transportation safety. So I'm going to give you a little overview about what those two things are. I want to talk to you about the project specifically that we were funded for by ARC. Actually wearing my Metro 21, my Smart Cities hat. Go over the kind of the methodology and how we did what we did in this planning grant, and then research grant, and then talking about what that means for rural transportation, and then again, love the Q&A, so please engage. So Safety 21, we're a UTC These are our academic partners. It's led by Carnegie Mellon, but we have University of Pennsylvania, The Ohio State University, CCAC, and Community College of Philadelphia are our workforce development partners, University of Texas Rio Grande Valley, and Morgan State University. In terms of what we do, we have this saying, our mantra is R&D and D. So we really have an emphasis on deployment. We talk about solving real world problems, and we don't do that in isolation. We have over 300 deployment partners that we collaborate and iterate with. They give us the feedback that the work that we're doing makes sense, that it's relevant, and that it can be done in, frankly, in a shorter time frame. Carnegie Mellon University is known for being very real world and very interdisciplinary, and we take that to the work that we do in our US DOT UTC. We've had close to a dozen spinoffs since we've had actually 3 national UTCs on safety and mobility, and we've had several companies that have been super successful, billions of dollars. We've also had ones that have gone on flames and have failed miserably and fantastically. So, and we learn, right? We iterate and we learn from that. But we are, again, about solving real world problems, and that means there's a market for the work that we do. And that means in a market economy, you can start a company. We also really care about policy, right? So we inform local policy, county, state, federal. And a lot of what we do, we push our researchers to ensure that they do think about how is this, because, it's a kind of thing, like you could have all the money in the world, but if it's against the law, you can't do it, right? So you've got to be thoughtful about changing policy as well as finding coalition support, finding common ground and public-private partnership. And then last, but definitely not least, we're a lot about workforce development and engaging with community colleges and high schools and K through 12. We do a lot of really great outreach programs. As my little icons here speak to those issues. In terms of our last fiscal year, 24 to 25, we were really proud that our UTC completed 29 projects. We have over 50 staff, faculty, and students in leadership positions. We have publications, 47 citations, faculty in transportation related areas, and we have 214 students. And again, that is something that is very core to the work that we do. I mentioned our deployment partners. You can see a full list on our website. It keeps growing. I met with a brand new partner yesterday, and the idea is that they sign up to collaborate and guide and inform the work that we do. I have a great website. I'm happy to put it in the chat. It's cmu.edu safety 21. I do a weekly newsletter. Some of you might already get it. I see nods from at least Stephen. It's the Dispatch. I inherited this from my colleague who's now at USDOT, Stan Caldwell. And he pulled together, it's like a blog format where I pull together all the latest and greatest with respect to transportation, infrastructure, internet, rural mobility, I throw in there oftentimes. And then every now and then I have a lot of fun and throw in something really random. So just to see who's paying attention. We have a distro list of over 6,000 and growing. And then we also send a newsletter every, like the first of the month-ish, that tells you what we're up to. And in fact, today will be one of our, what's happening, what's going on. And then we do seminars. Tomorrow, in fact, we have a seminar with one of our researchers. So if you want more information, reach out. I'll put make sure you get that info and I'll send it to you. Now I want to pivot and talk about my other child, Metro 21, which is, so my background before I came to Carnegie Mellon in 2017, I worked almost 20 years in the semiconductor industry and specifically in a technology called MEMS, which some of you guys will know is micro electromechanical systems. And what's exciting about MEMS is that it's this tiny little chip that moves. It senses and moves and it actuates. And it has opened up a whole new world, this Internet of Things. And in 2017, there was a real big excitement about a whole world that could be unlocked if we had everything connected. Sidewalk Labs was launched thereafter. We had such enthusiasm. We have since learned it is really hard. And as I have another presentation I do when I talk about smart cities and I'm a guest lecturer, is there's like, I kind of say snarkily that there are dead bodies everywhere because so many companies, big companies like Cisco and Toyota and IBM and Google have tried to do these kinds of highly integrated, connected infrastructure, connected C to V to X to E to everything, and have failed, right? And so it is with that I humbly come to you that I have a lot of, battle scars from the projects that I've worked on, but I still believe that we can solve, 21st century challenges by using technology as a tool, right, to inform and to collaborate. And so a lot of what we do, we've deployed over 70 projects. One of those is the work that we do with ARC, which is the idea that if you want to address an issue like rural mobility, it is multifaceted. It is like a game of whack-a-mole. You can't just put in new, shuttles and expect everything to happen. It's complicated. There are reasons why people can't afford reliable transportation in rural areas. There are funding issues, there are policy issues, there are socioeconomic issues. So this is the kind of work that I love doing, and I love being that connector and facilitator to bring communities together. And that's why this project that I'm going to talk about is a great example. These are some of the topics that we touch upon. And now I want to really get into the project that I did for ARC. It's a planning grant. There's the official, number there for what we called Rural Access Mobility Program, RAMP. Okay. So, it takes a village to do a lot of this stuff. And so the background is that, goodness, maybe 3 years ago, maybe 4 years ago. I'm trying to think. I think, yeah, it was like 3 or 4 years ago. There was this NSF Regional Innovation Engine program that was launched, right? And I'm sure many of you participated and tried to get money. There was like huge sums of money, right? The first year you're going to get $15 million or something crazy like that. And we had an ambitious goal, and the idea was, how do we connect Pittsburgh, which is often called the capital of Appalachia, right? Because within the Appalachian, the 13 states or actually more like the Appalachian community, Pittsburgh is one, if not the biggest city, and historically has been a center for commerce and over the decades. So given that and the role of Carnegie Mellon, how do we better connect the resources, the natural resources, the human resources, the financial resources? How do we connect them better to help grow the Rust Belt again, right? So it was extremely ambitious. I'm the first to admit it was overly ambitious. We did not get chosen for this. But one common thread that we heard throughout, and I'm sure that you have in your communities, is that transportation in rural communities is a real issue. It is expensive. It is hard to do. Having a vehicle in rural communities is expensive and hard to maintain. And oftentimes, greenfield development, and even brownfield development of new manufacturing is located here, and the people live here. And there's no transportation that connects them. There's no public transportation for sure that connects them. So this was a thread that we pulled. And we also found that in Southwest Pennsylvania, which is where Pittsburgh is, in northern West Virginia, and frankly, most of West Virginia and Southeast Ohio, we have a lot of commonality that people are actually living cross-state, right? So people live in Southeast Ohio, and they commute to Pennsylvania for jobs every day, hour and a half. In fact, there's statistics that show that our friends at Ohio University showed that for somebody with skilled a higher level of skill, like college degree, graduate degree. Average commute for those people is 90 minutes each way, that they have to travel that far to get a job that is commensurate with their skill level. Okay. So that's the background that we came together. And so we were able to pull together a proposal. We were thankfully funded by ARC. Our academic partners were West Virginia University, Ohio University, and then a regional industrial development corporation, RIDC, was an important partner. They actually, in Pennsylvania, I don't know if you guys have something similar to this, we have a lot of old steel mills and a lot of old manufacturing warehouses and a lot of manufacturing sites that are skeletons, really ready for the next generation of manufacturing. And the idea is that with a little bit of money, federal money, state money, private money, you can rehab those and create ways to attract companies to bring manufacturing, to reshore manufacturing. They've been doing this for over 20 years, right? Before, so a long time, probably 30 years. So they were an important partner because at the end of the day, it is also about jobs, right? And so we had this period of performance. So we finished last year, and I'm going to kind of walk through a little bit. I'm not going to read this, and I'm happy to share these slides with all of you afterwards. But basically, we were trying to better inform, address and inform and address, right, the economic issues that were affecting this community, specifically to mobility. So this idea that, there's this idea that people's their economic mobility is affected by their transportation mobility, their physical mobility. And so that was the premise. It was also this idea of using technology, using AI to inform this and create dynamic in real time transportation models that could be instituted. So we call it an integrated on-demand flex route service, as well as fixed route mobility service. So the idea is that we would create a plan, and as a deliverable, we would hopefully, we've applied for funding, and hopefully we'll get funding to actually do the work. In terms of background, we felt that we had to focus on certain communities. So we decided they would be contiguous, right? So we had, I think it's 24 counties throughout West Virginia, Ohio, and Pennsylvania, and in varying degrees of economic and strength and weakness. And we wanted to ensure that we had representatives of all of those counties in those contiguous areas. So you can see here, this is the cutout of that area. So, and what's interesting to me, I learned a lot, like Allegheny County, which is where Pittsburgh is, has the highest number of public transit, highest amount of jobs. And we did a lot of analysis of not just like where the jobs are now, but where they're going. So again, growth in our region isn't it's not a straight line. And so oftentimes, for example, there would be new developments in Washington County, but the way the transit was set up, all the transportation went to Allegheny County, and there wasn't that connection between the counties. Again, like in they call it the Panhandle of West Virginia, similarly, is that transportation was going to like the downtown areas, but that's not where the jobs were. So during and before the ARC project, we were funded by the Department of Energy to do a similar pilot in Greene County. And Greene County is one of the poorest counties in that region. 40% of the economy was coal-based, and the majority of those jobs have gone away. They have not come back. So they have, I think it's a third of the population is on disability. They've got lots of challenges, and they have no public transit. So it was a pilot that was funded by the U.S. Department of Energy, and we did it from May to September of 24. And we did a hybrid model with fixed and on-demand routes. So this shows you, we did a lot of survey analysis to figure out where people live. We surveyed where the demand was. And then we also, so then based on that information, based on the data that our transit, our partner, which is the Mobility Data Analytics Center at Carnegie Mellon, we created a pilot. We had a call center. So the other thing that I'm sure you're familiar with, like not everybody is really facile with a smartphone. Like my 88-year-old mother would want to call, right, to get a ride. So we made sure that we had a call center, and we also had to change our because of lack of internet and broadband and cell coverage. We actually had 1/3 of Greene County is not covered by reliable cell coverage. And so we had to shrink our service area by that 30%, and only because for safety we couldn't serve everybody. So that's just like one of these multi-headed hydra issues, right? Is that if you don't have not even cell coverage, right, you cannot do this on-demand dynamic kind of routing because there's no access, for people who are driving or living in those areas. But what we found is in the project that we did, we had donated vans from Honda. We had almost 300 people registered. We did it for 89 days with, on average, 50 to 60 daily trips with those 3 vehicles. The wait time was 11 minutes. In vehicle time, 10 and a half minutes. And in rural areas, like we kind of like say first mile, last mile. This is like, first 5 miles, last 5 miles. People can't walk that, especially if there's no sidewalks. But these people wanted to have these short trips to get to their destinations. And based on our model and based on the reimbursement, we were able to show that within 120 trips a day, you were able to break even. So we did this pilot, and it helped. And here's some graphics that shows you when people were using the route, showing you who was using, in terms of customer ID. We had one guy who had 160 rides. He loved it. He was, he was doing it almost twice a day for the whole period of the study here. The results were really exciting. Is that although it was easy to log in the web, people preferred to call. They wanted that connectivity. The control center aspect is critical, and that there was one point of contact, right? A central command was really critical. We had almost 300 users, many repeat, and the lessons learned was, a distance-based fare. So the other piece of it is because they have an access transportation, that takes people to doctor's visits and stuff like that. They were based on a cash basis for people who drove. So we were not able to do digital rides. So that was one of the lessons learned, was definitely we want to have some sort of fare system, which I'll get to in a minute. And then, people love the minivans, and marketing was really important, messaging. Rural areas are not that familiar with taking public transit, right? I grew up in a rural area. I'd never ridden a bus. The idea of waiting for a bus and not knowing when it's coming was so frightening to me the first few times. So that kind of information was really important. Don't undervalue the importance of the messaging and marketing. So then we took this and we adapted it to the three state proposed area that we talked about. And so we did a series of in-person workshops that were held in the respective states. We had 65 participants, and the participants. So this is really how, it's the stakeholder community that then represents the people was really important. So we wanted to make sure that we had a diverse view of all the people that we were serving. And the number one issue that everyone agreed on is that transportation is a barrier to success. Some photos of what we did. We had handwritten surveys. People really, again, people like to phone call, people like to take notes on surveys. So we had a lot of input from folks around these 3 states. We had a series of questions that guided. So we had the same set of questions in terms of our methodology that we carried across each of the workshops. We also did follow-up surveys with the people who wanted to be there and couldn't. Findings is that we wanted to focus on, even though food insecurity is a thing, food deserts are a thing, right? People can't get to a doctor's appointment. We really wanted to focus on enhancing people's ability to get to training or to work. So that was the one thing that was the string we wanted to pull on. The other finding is that we used the workshops and we used our stakeholders to help us find the origins of destination, right? The major stop locations and future jobs. Like where's the future manufacturing site coming? And then the other piece of it is that even though transit operators are bound by states and sometimes bound by county, people are going across state, and we want to create that mobility. The consistent fare system. So that was something that came up. That is frankly, it's a big deal and it's a really complicated nut. And so that is something that like the country of Canada has been able to figure out how to have everybody on one fare system and one card. Like if the whole country of Canada can figure this out, I feel confident that a couple of states could do it, but that's a big deal. The command center piece, really important. And then the other thing that was unique is we wanted to pull in existing providers. So it's the idea is that we're using those shuttle to create and supplement the ridership that they have and actually basically bringing more customers, more riders to them that they otherwise wouldn't have. The idea was to grow the pie, right? Not to take away nothing that we would do would replace existing transit. And in fact, it would bring more riders to them. So we had several critical part of this was the transit providers. So you can see the list here. And with them, we identified their fixed routes, the major points of interest, flag stops. We heard from them, hey, there's a new, processing plant, and they have added a third shift from 10 p.m. to 8 a.m. They want us to add another line. We can't do it. If we work together, this would really help us. We had criteria that helped us determine where the major stops would be. Okay, so we needed to make sure that if we were doing this like first 5 miles, last 5 miles, that we were creating locations that made sense and that they were accessible. There was parking space. So the idea that if, like for example, like one of my kids doesn't like to drive. So, there would be a place where I could pull up, drop my kid off, and they could safely then wait for the next bus to take them to work, that kind of a thing. We also wanted to have fixed routes. So what we learned is even though on-demand is great, if there was enough demand for a certain route, we could have a fixed route. So this was very appealing to the transit providers. And it's the idea of, it could be cross-state, connecting major employers in major cities and along highways. So those were the criteria that we set up for this. And then we created, we identified points of interest, a flag stop, which would be along the that fixed route, and then augmented by on demand for this like first mile, last mile, and short distances door to door. And the system assigns modes. So if you log into the platform, you don't get to decide if you want a fixed route or an on demand. The system actually does that for you, and the system also uses cost, pricing to help influence rider behavior. So first, in terms of our methodology, we identified the existing fixed routes. So these are the fixed routes in all the different little colors here that exists. This hub right here, that is Pittsburgh. So a lot of them were going, but then we also found that you had these isolated areas, and we had the locations. So that's the points of interest. And then we proposed these fixed routes, so connecting these points of interest that aren't already served by transportation. And then what this major map shows the employers. So the largeness of the red dot indicates the size of the employment hub. And so this idea is that we connect major employers, training centers, and emerging employers. The bubble represents the number of employees. So this shows you the big picture, which is the existing routes, which are the gray, and then the planned fixed routes, and sometimes on-demand routes. Like, for example, this could be an on-demand route, right? Connecting these two hubs to get to existing transit. We also wanted to prioritize where we would cross state lines. So these were the areas that we focused on. And then we also wanted to, this is an example of something that we wanted to do, was these are the existing routes in and around Morgantown, and we identified where there could be preferred service areas for major stops in Morgantown. This is for Athens near the Ohio University, and this is Pittsburgh, showing you the service area. So our suggestion, and this is what we sent to ARC at the end of our project, is that we wanted to ensure that what we found in our research was validated by the transit providers. We wanted to have that ensure that the fixed routes would be connected to the existing routes, that it would create more ridership for them. We wanted to figure out where it made sense to do on demand, where it could help with that first mile, last mile in very rural areas. And then the command center, again, was really critical to all of this. So where we are now, we submitted a pre-application implementation proposal for non-construction to ARC, totaling about $7.5 million for 3 years. What is daunting, frankly, is the cost match requirements are almost 1-to-1. And for transit agencies, that's a big hurdle. Frankly, getting cash match is nearly impossible. So that, I will tell you quite frankly, is something that concerns me, especially in this funding environment. So we're waiting to hear if we will be invited to submit a real proposal. It should be happening soon. But the reality is we've got some great research. We've got some real partners. And I'm here because I'm, open for collaboration, and I'd love to talk to you about this, because this is not an issue that is just unique to, Pennsylvania, Ohio, and West Virginia. So that's my last slide. My contact information is here, and I would love to hear your questions and have a conversation, hear about the challenges that you're dealing with, and, let's take it from there. Thank you.
Excellent. Thank you very much, Karen. That's what I thought would happen. Great presentation, lots of energy. And look, lots of thoughts. I mean, we're here down on the Alabama. We're on the tail end of Appalachia, but we're dealing with the same issues. And I think everything that you said probably resonates with the folks on the screen. I would be interested to know, open it up the floor to the audience. Any questions for Karen? You're welcome to put them in the chat or raise your virtual hand or your physical hand. And I saw Dave Myers raise his physical hand. So yeah. I can't see everybody on the screen at once. So we'll let Dave do his question, and then we can go from there in an ordered fashion or a chaotic fashion, however it actually goes down. Dave?
Yep. Thanks, Stephen. And hi, Karen. I tried to raise my digital hand, but I couldn't find how to do that. So I raised my old-fashioned hand. Great presentation, and for various reasons, and Stephen will know as well, but I love the topic of rural mobility challenges because it often gets neglected or it falls down below everything else
Yeah.
because it's not very sexy and hard to fund. But quick question. I run a nonprofit called Mobility Futures Alliance, and we have a similar mission, better transportation or improving lives through better transportation. So it aligns with your mission, which is great. So I loved your presentation. Curious, because you had lots of numbers. Looks like you have a business model, you have partners, you've demoed it or created a pilot. I mean, so on paper, it should look like, hey, this is a worthwhile investment to improve not just your area or all the states, but obviously if it works, you'd want to use it in other parts of the country as well, if the model works for those size and similar challenge communities. What would you say, generalizing, like your biggest hurdles to getting to yes? Because you have numbers, you have all those things that, you had a lot of depth to what you did, and a demo. Is it just consumers don't want to change, or the federal government is too complicated, or how would you generalize those giant hurdles when you think you have it sorted out on paper, but it's still so hard to push forward?
Yeah. Thank you, David, and thank you for reaching out to me on LinkedIn yesterday too, giving me a little vote of confidence for today's presentation. I appreciate that.
Yeah, sure.
There's a couple of things I think that are really challenging. Transit agencies are conservative. They have to be, right? They cannot change routes on a whim. There's a public and there's a process. They are not dynamic. By nature, they are not dynamic. They are also governed by state and federal law. That's a fact, right? What we're proposing is dynamic and moving and changing, and it is requiring funding to support the project. I mean, I think and the other piece of it is, if we get 3 years of funding and we are super successful because we were able to raise the money for this pilot of 3 years, but then in year 4, we have no funding. What we have done is have raised the hopes of thousands, potentially tens of thousands of people, and then screwed them over. They can't get to their jobs. They can't get to their training. Okay, I'm just playing the devil's advocate of why a lot of transit agencies said, I cannot commit to this. In Pennsylvania, I don't know, David, where are you located?
I'm all over the place, but I currently live in Milwaukee.
Okay. So I don't know what the situation is in Milwaukee, but in Pennsylvania, we actually had like a government shutdown for 4 months that there was no budget. And the fight was over public transit in the 2 cities. And so what Pittsburgh Regional Transit had to do was take funding that was supposed to be for new vehicles and use that to subsidize transit operations. That's not sustainable. So that's your backdrop. West Virginia, similar situation. Because I mean, we think about it, like we had the CARES Act during the pandemic, there was so much money being thrown into lots of programs. We had this like generational funding that went to support programs. And now we're being left with lots of costs and no income to pay for them. So transit agencies do not feel that they can be liberal or entrepreneurial by definition. So that, frankly, is the biggest hurdle that we're dealing with. So that's a big hurdle. The other hurdle is Pennsylvania law will not allow a Pennsylvania transit agency to cross a state line because of insurance. Insurance companies in Pennsylvania, because of state law, PennDOT law, cannot cover transit into another state. They would have to get an additional insurance rider. Again, an additional cost that they would have to bear. This is not the case in Ohio. This is not the case in West Virginia. I don't know Wisconsin. I don't know enough about your geography, but crossing state lines, which is what we intentionally wanted to do, was actually not legally feasible, right? It would be really hard. So to my point earlier about policy is so critical. We would have to change state law, right? That's another hurdle. The fare system, the interoperability of fare systems. There are none. There is no interoperability of fare systems in this country. They've done it literally in the entire country of Canada and in other countries. But here in the United States, counties have their own fare system. They are not necessarily interoperable. So that's another hurdle. So there's a few hurdles. And those are big ones. But it's not necessarily about the actual people. The people and the agencies, the social service agencies, they hear time and time again that transportation is a barrier to people getting jobs, to people, like reliable transportation is a barrier. So we know there's a demand. We know people, but these are, I think in Washington County in Pennsylvania, it's something like 60% of the ridership of this rural transit provider, Freedom Transit. They have no other option than that transit provider. They don't have access to reliable transportation. So these are people who have no other choice. So, increasingly numbers, like a quarter of Pennsylvania in the demographic we were looking, a quarter of Pennsylvanians are on disability. A lot of them don't have the ability to drive. A third of West Virginians are on disability. They don't have the ability to drive for whatever reason. So these are also barriers, so that this idea of shared transit options in a shuttle, right, that is a minivan, is really appealing. So that's not the issue. It's not the people. It's the bureaucracy. It's the agencies.
The systems.
The systems.
That's right.
Yeah, no, thank you for that. And we did a project in Southern Michigan, and they had the same issues with state borders between Michigan, I think Ohio or something. The people went across all the time. It was normal for them, but the systems didn't like that. And so that caused a lot of problem. Thank you for that. I'd love to keep talking offline, so I don't take up too much time. I'd love to keep talking.
Yeah, I'll put my email in the chat, and I put our website in there too, but feel free to reach out. I see a question. Should I just go to the questions, Stephen?
Yeah, that's great. That first one there, from Javier. That's one of our students here in Alabama, Karen, who's been doing specifically some rural transit healthcare related research and shared mobility and stuff. So and he's a modeler. So
that's why this question. Okay, let me just read it. Plans to apply simulation. So first question, absolutely. And in fact, there's a company called Trafficure that has spun out from this work. I'm going to put them in the chat. So the Professor Sean Chien, he is he's a great guy. Here, I'll find him here. He is the one who has a bunch of PhDs who are looking at this issue. Funding to support this research is great. Funding to support this work is also great. So do we have plans? Yeah, if we get funding from ARC, absolutely, we plan to. Is the data accessible? Possibly. I would need Javier. It's Javier, right? I would want you to, why don't you drop me a note? I'll connect you with Sean, and I can connect you with his PhD student, David Sai, and we can see if there's an opportunity for collaboration. Let's see. Venkatesh. Okay, great talk.
If you can just tell the question to the audience just for the future video recording, that would be helpful.
Oh, perfect. Of course. Okay, great talk. I'll say that again. You touched on this a bit, and though I am curious to hear your thoughts on how do we sustain programs for agencies beyond just the pilots? From a community point of view, how can something that shows promising results in research be made permanent? Yeah, I mean, I think that is the $1 million question. I think the fact that we back in Greene County, they are requesting us by name. They want us to come back. We have tried unsuccessfully to get funding from the state to support this. I'm going to foundations trying to get funding to help support the work. And so it is, again, it is not an issue of a lack of demand or the people are wanting this. It is the transit agencies, it is the state governments that are the hindrances to this, frankly. And I also feel that there's an opportunity for more, like, again, this idea of dynamic on demand is really exciting and really interesting. If those of you that live in cities, you have Uber. I mean, a lot of these places don't have, all of these places, none of these places have Uber, right? Partly because of the issue of internet access and cell coverage. There's a company called Via that has done some work in North Carolina, right? And in other places. I think they're now a publicly traded company. They are betting on this, but they are a for-profit company, right? So I think checking out what Via is doing could be a potential. I also work in the area of autonomous vehicles. So I do feel that in some cases, I will say drivers is an issue. So if there's an opportunity for more automated and safe transportation, that could be something. The one thing that I want to also point out that we really liked, but it was a point of contention, was our shuttles didn't require a commercial driver license, but unions required that the people hired had a CDL. And so again, the system was set up to cost more money. So our project was a Honda Odyssey minivan that would seat 6 people. And that was meeting the demand of the place we served. But the agencies that were considering taking this on, they had to have drivers that were CDL. So that doubles the price. So there's some challenges. I think there's some cost-cutting challenges that need to be addressed, some big decisions that need to be made, and that transit agencies are not dynamic. They are not risk takers. So this is not an easy thing.
Any other questions?
I gotta go, Nate.
Okay, great. Go, Ali.
Yep. Again, thank you. It was really great talk. As you know, CR2C2 is primarily looking at this problem from a slightly different lens, and that lens of technology. And I wanted to hear your perspective throughout all these interactions. What are the kind of most highest priority of the technologies that you think would help? And presumably the vans were regular vans, they were not necessarily automated. From your talk, I was hearing primarily the booking system was one area that you have been synchronizing the phone and cell phone and application softwares to do that. But what else do you think that from the technology perspective could help facilitate this whole process?
Yeah, absolutely. And I think if Sean were here, Professor Sean Shen, he would have talked a little bit more about the technology behind this, because it's this idea if that there's they used iPads and iPhones. And so it was this dynamic, very dynamic booking system that was able to, in real time, predict also based on what had happened at that time of day, on that, that day, like what the expectation of demand would be for these locations. So it's this idea of using an AI model to help predict what the demand is going to be, and then provide a ride either on demand or a fixed route connecting to an existing route. So there would be very little lag time, right? The headway would be enough that it would, because, reliability and also ensure reliability. So using AI and using that technology to help improve the operations, the system was definitely something. The interoperability of fare, and then also using dynamic pricing so that, if you and I are going to call for the same ride, um, I have to be there at 9 o'clock. You, Ali, you could be there at 9:30. So I'm willing to pay, like 20% more because I need to be there on the time that I need to be there. So that, but done in a transparent way, like that kind of use of technology. That's something I think that's exciting, and we're seeing a lot of interest in that. So I think there's opportunity for technology. The fare system kind of monitoring, I think is also something like it seems so trivial, but so many transit agencies are not digitized, right? Their fare systems are on a PDF, right, on someone's laptop. So there's a lot of in rural areas, even though they're supposed to be in compliance, the compliance isn't enforced. So they literally aren't, their GTF files are not available, right? Like
Right.
it's so that's some of the challenges that we have. But I do feel that like Via, like looking at Via, I don't know if you've looked at Via. We did have them as part of our stakeholder, and they came to part of our, like they were part of our process. I'm excited by the work that they're doing, and I hope they're doing it in a way that is also um, fair and open. So yeah,
Thank you.
exciting. I mean, this is not an easy thing, and I think it's great. Technology can definitely solve a lot of these issues, but I think the challenge is that some of these places are still very analog. So being mindful of that is really important.
Thank you.
The obviously anybody has any other questions, please drop them in and such. But just real quickly, Karen, just talking about VIA, we've circled around VIA, some partners on NSF, some federal things or whatever, and I'm leading to a question about match and that sort of thing. We had some ups and downs working with VIA. They were technically responsive and all that. But the partner that really stepped up for us was Enterprise Commute. So it's the Enterprise rental company, and they have some commute vans and stuff. And they were super creative about amortizing out and depreciating the vehicles and all that for match. They were super creative about it, which gets to my question. I mean, to the extent that some of this is workforce related or whatever, what's the barriers or opportunities in terms of getting employers to step up with real match?
Yes, that's exactly what I want. That's my dream.
Okay.
That's what I want because we here in Allegheny County, manufacturing companies are complaining that they have 1,000 unfilled jobs. People, just qualified candidates aren't showing up. And then we're hearing, I'm a qualified candidate. I'm living in West Virginia. I can't get to you reliably. So wouldn't it be great if the employers stepped up and said, we're going to provide funding to help make this happen? Absolutely. And I will say that healthcare providers seem to be the most willing to do that. So there are projects that we started to look into in working with the hospitals because it's still an area of growth. Um, they need qualified people to work there reliably. They're willing to pay for transportation. We are seeing examples, little mini examples of that happening in the Pittsburgh region. So I think, finding the right employer who's willing to bet on this and they see the value, they can see the ROI because they are running on such tight margins and they're, a lot of them say they're nonprofits, but they're really for profits. They're willing to invest in this. So that is my dream. That is absolutely my dream, is that this is sustainable, because employers step up. Absolutely 100%.
Nice. We're circling around with a pretty heavily capitalized industry here in Southwest Alabama. And I mean, to the point where one of the meetings on a lark, I just threw in some slides about May mobility and automated vans. And they perked up that, that they might be interested in, funding part of a pilot, that kind of thing, whatever. But they are only interested in transporting their own employees.
Right.
Period.
Right. So use that. Start with that
Yeah.
and go from there. Yeah.
Yeah.
We have a similar issue. I see a question from Zihe. Thank you for the great presentation. Thank you. You mentioned that AV shuttles can reduce driver costs, but the vehicle purchase cost is still relatively high. Absolutely. Have you considered how different ownership models such as leasing or renting the vehicles might affect the economic feasibility? Absolutely. I think the other thing I forgot to mention was ADA compliance. So that cost will double the cost of a vehicle if you make your vehicle ADA compliant. We looked into also the Buy America. Buying American vehicles can be very expensive, frankly. But if you can sometimes get around it by leasing foreign vehicles, like if you want to lease a Honda. So that's something that we looked into, is leasing vehicles or buying used vehicles. But being mindful of ADA compliance, we looked into, in our project that we did for that 4 months in Greene County, it was between $30,000 and $40,000 additional to retrofit a van to be ADA compliant. So yes, but again, if you can use the vehicle for a good 5-6 years, you can amortize over that time. Thank you for the question.
Any remaining questions for Karen?
Well, I've really enjoyed this. I love the questions and the engagement. Please feel free to reach out. Don't be a stranger. And maybe I'll see, you never know, paths cross. Stephen, maybe I'll see you soon in DC or down at Auburn this summer.
Yeah, we need to get you down this way. Absolutely.
I'd love to. I'd love to. All right. Thank you so much, everybody. Have a great day.
Thanks, Karen. Thanks, everyone.
Thank you.
Bye.
Thank you.
Bye.
Bye-bye.